Hello, my name is Dr. Robert Arnone. I'm an upper cervical specific doctor, also known as the brainstem doctor. Here to talk with you today about fibromyalgia and some things maybe you haven't heard before or some possibilities possibly for you. So first of all, fibromyalgia, the term itself, what it means is a pain in the muscle fibers. And in order to be diagnosed with fibromyalgia, you would have to have 11 of the 18 pain sites that would be tender to palpation. So in other words, there's 4 pairs on the front, 5 pairs on the back of spots that if they're pressed, that should elicit a pain response in at least 11 out of the 18. The other part of the diagnosis would be that you'd have pain in multiple parts of the body that were there for at least 3 months. So if we've got that and it's considered that you have fibromyalgia, what do you do next? Well, most people go to the rheumatologist, which is a specialty in medicine, dealing with arthritis and pain syndromes and such. And typically they're given medication. So we're looking at things like muscle relaxers, maybe looking at antidepressants, maybe sleeping pills, so things like Flexerol, Zoloft, maybe Xanax, a few different kinds, Lyrica. And so basically, here's the thing. If you're someone who's taking medication for fibromyalgia, are you happy with the results you're getting? I understand it helps you through situations like you might say, well, I wouldn't be able to get through work day without it, or I wouldn't be able to go to, family events, or be able to do anything socially, or, I'm sure you have a lot of reasons. And if it helps you and you're happy, then hey, don't knock it, right? Keep doing it. This message is more for people who want to find out if there's a better way, want to find out if there's more than they've been told. And that's what this is all about. You see, because we know that there's an interference or pressure in the upper neck, base of the skull, and top of the neck, which is where the upper cervical spine sits, these round bones that surround and protect your lower brainstem. What happens is they can get in the wrong position from birth, from falls, from sports injuries, car accidents, many reasons. But what happens is the bones get in the wrong position. So here is an example. Here's a model of the base of the skull and the top bones of the neck. Through this opening, these bones are considered round type bones, if you will. Through this opening, we have the brainstem and we have the spinal cord. If the bones are lined up properly with the skull, brainstem sits comfortably, we have good function. Good impulses to the brain, brain's going to function correctly. The connection between the brain and the spinal cord is there. It's wide open. Good things. The problem, though, is when these bones get into the wrong position, slips to the side, turns. Now we have, instead of that opening being wide open, it actually compresses that brainstem. There were a group of doctors at Chicago, neurosurgeons, who they found that fibromyalgia symptoms and chronic fatigue syndrome symptoms come from a pressure or compression on the brainstem and spinal cord. Their solution is to cut the back part of these top 2 bones, in some cases even cut the opening in the base of the skull to make it where it's wider and it gives more room for the brainstem and spinal cord. Now, not only is that extremely dangerous, and actually those results are questionable, they help some, but then people are getting meningitis. They're getting these conditions from opening that area up. Not to mention, it also costs $30,000, give or take, out of your pocket. What we do is we thank them for their proof that the problem is here, and then we leave it at that. We're not looking to cut open the back of your head and skull at the brainstem. We're not even looking to have you on drugs. Actually, we have found phenomenal results with analyzing this area. Ideally, we'll take pictures from the front from underneath, from the side, different views, different angles to see how these bones relate to the opening in the skull. And if the bone is sitting to the side, if it's twisted, we're going to see all that and know exactly how it needs to be put back to be realigned properly again. That's what it takes. That's what you need. You need this to be in the right position. No drug is going to do that. And even the surgeries that they do for $30,000, they don't do that. This is what can help correct when somebody is diagnosed with this problem of fibromyalgia. And so the only way to know is to get checked. We can discuss this, we can talk about it, we can see if we can help you. I will sit down with you personally and let you know if I can help you or not. If I can't help you, I'll let you know that too. But how are you going to know if you never try? We are located very close to St. Louis Lambert Airport, about 8 minutes away, down I-70. We have an affiliation with the Haven House, so you can stay there for a very affordable rate. They include meals, and they also include a shuttle to get you here and get you back. So everything's in place to find out if we can help you. If you're coming from out of town, or if you're fortunate enough to live real close to the clinic, within an hour or 2 or 3, you can come on out. I suggest you make an appointment, and let's see if we can help you. I'd be happy to talk with you through email or on the phone initially for a very brief conversation, but what it comes down to is sitting down in my office, allowing me to ask you some specific questions to get the best understanding, and then putting you through some specific tests so we will know if we can help you. What you've been told so far is not everything. And it's certainly not if you are hearing this is all you can do and this is it. This is the only answer. This is what you have to do. Don't believe that. There's more hope. There's more possibility for you. You are worth it. Contact me. Let's see if we can help you. Thanks for watching.